In studio for the rest of this hour is Dr. Paul Song. He is a radiation oncologist, a member of the faculty at the Samuel Oschin Cancer Center at Cedars Sinai Medical Center. He's also a visiting fellow with the California Department of Insurance on Healthcare Policy and on the board of Physicians for a National Health Program and People for the American Way. And he's the executive chairman of the Courage Campaign. I'm so pleased to welcome you back to Uprising, Dr. Paul Song.
Thanks for having me back.
Well, today is a very, very important day. Some would say an historic day. You are, of course, on, as I said, the board of Physicians for a National Health Program. So you are a strong single-payer advocate, which is also sometimes known as Medicare for All. But let's focus on what we know about the Affordable Care Act and what it seems Americans don't know. How has right-wing opposition to the Affordable Care Act and all of the things we're seeing in the Capitol today, in Washington, D.C. today, that's causing so much disgust among the public, how much of that has actually contributed to the public's perception of the benefits of the law? And of course, it benefits Republicans if Americans don't understand what the law is.
Well, I think part of it is the Republicans going out on a limb and really smearing and spending a lot of untruths about the exchange, or the whole plan in general. But I also think that the president and those of us that really wanted healthcare reform didn't do a good enough job explaining the good things that are in there and the tangible benefits that are, many of which are already in place. So I think that when I talk to patients who come in who are concerned because they've heard all these lies and the truths, I have to spend time on a one-on-one basis explaining that. And much the same way, I think as people take the time to go visit the exchanges for themselves and start to plug in the numbers and the simple questions that they ask, I think they'll see how all of the things that they've been told are absolutely untrue about this.
Well, I want to quote Michelle Bachmann, who gave an interview to WorldNet Daily this week. And in this case, it is quite appropriate to quote her because people like to dismiss her as an extremist, but it is precisely the Tea Party faction of the Republican Party that she's a staunch member of that is the reason why we're seeing a government shutdown today. She said, quote, "I think the reason that President Obama can't wait to get Americans addicted to the crack cocaine of dependency on more government health care, because once they enroll millions of more individual Americans, it will be virtually impossible for us to pull these benefits back from people," end of quote. That sort of seems to say it all, what the real agenda is here.
Well, the sad part about this is many of us on the left would have liked a real government-run healthcare system, which would have been a single-payer healthcare system, very much like an expansion of Medicare. But for those that are not government fans, they should be happy that this is the healthcare plan that we came up with. This is actually a subsidy to the private insurance industry. So we're keeping the private insurance industry very much entrenched in our healthcare decisions and in the overall process. So when she says that we're getting people addicted to a government-run program, that's simply not true. This is keeping sustaining a Republican idea. These individual mandates and private insurance-run healthcare systems were originally touted by Richard Nixon, passed on by the Heritage Foundation. So when people say that this is a government-run plan, it's not. The government is simply giving us tax credits or vouchers for those that can't afford it to go out and purchase private insurance on the exchange.
The Washington Post is reporting this morning that several of the 34 federally administered websites hosting the insurance exchanges were giving people error messages. And, we should say all 50 states have online exchanges that went online. Some of them, like California, are doing their own. Others, many of them states that opposed Obamacare, at least whose governors opposed it, have relied on the federal government to roll out their insurance exchanges. Some have postponed their opening by a few hours. Others were very overwhelmed by the number of users attempting to get information. And of course, it should come as no surprise that a complicated new system that's just coming online will have glitches. But how is the Republican opposition going to take advantage of this? How imperative is it, politically speaking, for this launch to go smoothly?
Well, I think that it's inevitable that there will be glitches. Very much like when you upgrade your iPhone software, there are glitches in the first several weeks. Then they've constantly repair and fix that. This is something that's never been done really in the history of the United States, to develop an online exchange for the people of the United States. So it's inevitable we will have some. But I do think that when people go on their individual statewide exchanges, or in those states that have refused to implement it themselves, they'll see that this is very much like going on orbits and booking a flight in much the same way. In some respects, it's simpler. I actually went on the Covered California website several times just to test it out myself and put in different scenarios. And I think most people, when they see that, they'll be like, wow, this is actually pretty simple. Now, does it mean that there won't be some future glitches for some people getting on, either in terms of connectability and things of that nature. Yes, but that's why in addition to the online exchange, there is also a phone number that people can call and have a personalized one-on-one a situation where that navigator can take them through the whole process.
Let me give out that information. If you're online right now, you can check out coveredca.com, coveredca.com. There's also a toll-free number, 1-888-975-1142, 1-888-975-1142. And by the way, on the issue of website glitches, apparently Fox News is running a glitch watch on its website. So let's talk about nuts and bolts of the online insurance exchanges. The enrollment season starts today, goes through March 31st of next year for coverage that can begin on January 1st. So somebody who's uninsured right now can start shopping. They have until, if they want their coverage to start, I understand, on the 1st of January, they have until mid-December to pick it, but they can even go as late as next March. So if they start, say, in February, they can get coverage that starts right away. Is that accurate?
That's correct. So, and that's the question. So particularly for younger adults, and I've had this discussion with several young adults who are trying to figure out how they can maximize coverage but minimize their costs, because for them, even $95 a month is a lot. So they're trying to figure out, well, if I wait till February, the last day of February, will I still get covered? And technically they will. The issue of insurance, as you mentioned in your opening, is that many people don't expect to ever need it, and particularly young people. They're considered the invincible population.
Right.
But they're also the ones that tend to be very active.
Rock
hiking
climbing
and things on that. And all it takes is one visit to the emergency room for them to potentially go into bankruptcy. So I think they need to really weigh out that the whole idea of insurance is to protect them from any catastrophic situation moving forward.
So a huge aspect of the Affordable Care Act's health insurance exchange for uninsured Americans is the issue of government help, affordability. The federal government, I understand, considers individuals who make less than $11,500 a year to be eligible for federal subsidies that for somebody making just that little could cover the entire cost of coverage, or almost the entire cost. But what happens if you make just a little bit more? I mean, if you make $13,000 a year, you're still extremely poor. Do you still get help?
And actually, they've raised those numbers a little bit in the last several months. So for people who are individuals who are making less than $14,856, they now qualify for Medicaid, whereas before they would not, particularly single individuals. For families of four, it is now $30,667 or less that you will now qualify for Medicaid, or in California we call that Medi-Cal. For individuals making between $44,000 to roughly $92,000 a year, they will actually qualify for a subsidy. $92,000 is for a family of four, will qualify for a subsidy to buy health insurance on the exchange.
So even somebody making as much as $44,000 a year could get some help if they are uninsured.
Correct.
That's a pretty decent salary.
It really is, and I remember
I don't
when
make that much.
Well, that's the thing.
But I do have health insurance.
But that is the thing, that this is a good thing, and as people really take a step, they'll be surprised. They'll be like, "Wow, I get some money back." And in some respects, for those people who are making $44,000 a year, they are paying taxes.
Right.
So they are, in some respects, contributing to getting money back so that they can buy insurance.
Absolutely. All of these subsidies are things that we as individuals pay into, and that's things like that's what Michelle Bachmann fails to take into account. And even if someone is making $44,000 a year, if they don't have health insurance, buying it on the marketplace before this online health insurance exchange was up would have been a very expensive prospect.
Especially if you're female. Prior to the Affordable Care Act, just being female alone caused you to have much higher premiums than your male counterpart who was your same age and maybe same health and all of the other things.
So let's talk about how eligibility is estimated. How do people, when they go on this website, let the government know? I understand you have to estimate your projected income a year in advance. So that means if you're unemployed this year, but you know you're going to start a new job next year, you have to estimate your salary. But you might be unemployed through March of next year. And once you have been considered eligible for subsidies and bought your insurance, you might get a job with or without employer benefits. Will you have to self-report now that your income has increased and then end up losing subsidies? How does all of that work?
So that is one of the sides that the Republicans or critics of this have, is that there's a lot of sort of honor system that you kind of have to, you can technically lie about how much you make in order to game the system. But in the end, the IRS will check to see what you, your ticket stub matches, pay stub matches exactly what you report in terms of getting the tax credit or the voucher to buy insurance. What will happen is it's very simple. You go on the exchange. As I mentioned, I did it the other day. You put in your age, you put in your sex, you put in your salary, what you anticipate your salary will be, and your area code. And then it gives you not your area code, your zip code, and it gives you all of these options in terms of coverage, and it gives you multiple choices. Very much again like going on orbits. If you want a non-stop flight versus a multiple, you want the cheapest flight, they'll give you based on that. But then you also have increased coverage. It gives you decreased deductibles, all of those things, and from that you can personally look at what you think is the best thing that you can afford and are willing to accept in terms of coverage.
And of course, the devil is always in the details. The people who are uninsured, who may never have had health insurance, especially young people, may not understand what is a deductible, what it means to have certain things covered and other things not covered. A lot of health insurance companies are very good at hiding details in plain sight. May sound very comprehensive coverage, but when it comes down to it, the very things that you needed coverage for, you end up not being covered. But is that a whole different story about Americans being underinsured?
Well, 2 questions, 2 points to that. First, let me just to say the one thing about the plans that you'll see on the exchange, they've all been pre-screened by the state commissioners, so that they all have to offer a certain minimum amount of benefits, versus if you were just to go and purchase insurance on your own and go through Blue Shield or any of the providers, commercial providers, they may not have given you the full picture of what they would cover. And many times things could have been hidden in the fine print. And when you got sick, you thought you might have been covered, those things were left out. That's no longer the case. All of the insurance plans that are offered on the exchange will have to cover a certain minimum. So there are real good guarantees there in terms of what you can expect out of your health care coverage.
Any idea, or can you give our listeners a sense of what those minimums might be?
Well, so there's the one things the things that we know the most of is that prior to the Affordable Care Act, insurance companies could charge you unlimited amounts of copays and deductibles and things of that nature. Now there's an actual lifetime annual cap that, depending on what you choose, the amount that you'll have to pay out of pocket is $6,350 for an individual, $12,700 for a family of 4. So again, even though it won't completely eliminate medical-related bankruptcies, it will reduce the number of medical-related bankruptcies. Just in terms of knowing that you're not going to get nickeled and dimed with every copay and deductible and things of that nature. And then once you reach that, although some people would argue $6,000 is still a lot of money for an individual to come up with when they're sick, that at least you have a set limit in terms of what you have to pay. And
certainly before that, the sky used to be the limit.
Absolutely. And so that is one, again, an advantage of that. It's still not, as they say, it won't do away with all medical-related bankruptcies, but the idea is that it should reduce that.
And just going back to the issue of subsidies earlier, you talked about Medicaid and how people can become eligible for Medicaid. Initially, it used to be Medicaid was the program, federally administered program, or federally funded program that here in California is called Medi-Cal, that people with disabilities and the very poor were eligible for. So they've now increased the limit for who can be eligible. It might be that people who've never been eligible for Medi-Cal before are going to be eligible now. Do they find that out through the online health insurance exchange website or through Medi-Cal offices?
So actually, if you go into Medi-Cal and you put in a salary that is what I mentioned, it will immediately say that you're eligible for Medi-Cal. And that's one of the things I wish that people did more of. So we focus so much on the exchange and for the people making between 138% of poverty to 400%. But the below 138% 138, that's really a sort of a forgotten population, and yet they're the ones that can immediately access Medi-Cal right now. And when we talk about corporations like Walmart and such who come into these places and pay low wages, this is the argument that they're reneging on their responsibility to take care of people and provide benefits, and they're putting it all on local jurisdictions and states by basically paying them so low that now they qualify for Medicaid. That's how they're avoiding having to take care of health care for their employees.
If you're just tuning in, we're spending the hour taking a look at the Affordable Care Act's online health insurance exchanges that have all gone online today, that have been launched today around the country here in California. It's called Covered California. My guest, Dr. Paul Song, is discussing the basics. We'll also be taking your questions later in the hour. If you have questions, listen carefully to the first half of this program to see if we address them. If we don't, jot down your question and then call us later in the hour. We'll be giving out that phone number. Don't call just yet, but when I announce the phone number, do give us a call and we'll try to get to your call on questions that you have about the health insurance exchanges. Let's talk about pre-existing conditions, which is probably, I think, one of the most significant aspects of the Affordable Care Act. So insurance plans that you buy through these exchanges, I understand, cannot deny you coverage if you have pre-existing conditions. But what I think is even more significant is that they can't charge you more for it. It used to be that if you had cancer or some terminal disease or just a chronic illness, they could either deny you coverage or they could give you really expensive coverage. So what's the situation now?
That's exactly what's happened. And part of the reason that the Affordable Care Act is doing away with pre-existing conditions is it's the idea that we're all going to do this together. That for the person that's sick, there'll be 3 or 4 healthy people that will buy coverage, and that you're going to pool the risk and you're going to spread out the risk over a general population, which is kind of a really nice way to think about healthcare in general. So yeah, that is the case. If people go to the exchange, they will be shocked. It won't ask them for what their medical health issues are. The only thing it will ask them is about their age. It won't ask them about whether or not they smoke. It won't ask them about whether or not there's any cancer in the family. It won't ask them about whether or not they've had any prior surgery or their medication.
You brought up smoking, but I saw somewhere that that smoking is something that is taken into account. They cannot account.
No, if you really look at the exchange, that they don't ask any of that personal information. That's what's also people would be surprised, and that's the idea that
not to encourage smokers, but
correct. The deal and why the insurance industry was a little reluctant was, if you are going to cover these people, how are we going to offset the risk? And that's how the exchange really, or this whole Affordable Care Act will really succeed, only if everyone participates. If the younger people under the age of 20 between 26 and 40, who generally are considered to be healthy, if they all opt out of this, then this whole program is pretty much doomed to fail, because they are, in some respects, making up for those people that have the health problems.
So that's where the individual mandate comes, and let's talk about that. What happens if people who are currently uninsured don't buy coverage? What happens to those people after the deadline of March 31st of next year? Are they penalized, and if so, by how much? How does the federal government know who has insurance and who doesn't?
So the way this will, a lot of this will fall on the IRS for people who file taxes. They will then look at, in some way or another, whether or not these people have coverage, either through their employer or through the exchange. It's pretty simple that you can do that. Now, granted, will people fall through the cracks? Absolutely. But the idea is that that's how, they're going to check to see if you have coverage. And the other thing is that once they do, then if you haven't done it, then there is a penalty that people will have to pay. What they say is it cannot exceed more than 2% of your annual income. For most young people, it may be $95 a month. Is what they're estimating. But the issue is this, that again, for a lot of people, I think once they see it, they're so used to looking at premiums that were so outside of their realm of possibility. And I think most people would really like insurance. But when they see that it's relatively cheap, and much cheaper than they thought it was, and really within reach, I've actually had friends of mine who were shocked at how low they can get coverage for now on the exchange. They work at home, they're graphic designers or other people in the arts who self-employed. Yeah. And for the longest time, when they've had to go to the ER or something, they've end up spending more in that one visit than they would for a whole year. So I do think you will see more and more people, once they actually see what it will be specifically for them, they will be more interested in participating.
Now, I understand that there is, going back to the issue of pre-existing conditions, people with pre-existing conditions can still be discriminated against if they have individual health insurance plans from companies before the Affordable Care Act took effect. So if somebody had a chronic illness and was unemployed, had a Blue Shield plan, for example, that didn't cover their illness because it was considered pre-existing, and at that time companies weren't forced to cover it, those plans are grandfathered in, right? However, that same person with that chronic illness could say, I don't want to have this plan anymore, and I'm going to shop on the online insurance exchange to see if I can get the same coverage or better at the same price that will actually cover my illness.
And it really depends on how big of a company does that person work for. Okay. So if that person works for, say, a company of 10,000 people, the most insurance companies view that as just a small glitch in a big pool. But if that person's working for maybe somebody with less than 50 employees and that employer's trying to give them health benefits, that probably is raising the premiums for the entire pool, not to mention that individual. So many times that individual may find better coverage on the exchange.
Okay, let's talk about who's eligible. One of the big aspects of the ACA, the Affordable Care Act, is that undocumented immigrants are not eligible. This is particularly significant in California that has a large undocumented population. Will these folks simply have to live in the shadows? And if they're not eligible for health insurance, they're also obviously not going to be penalized. But then when they go to the ER, as they do now, they face huge costs, or sometimes they risk their health by not going to the doctor at all.
Well, sadly, you've touched upon the one piece of bipartisanship where Democrats and Republicans could both agree, and that was to exclude undocumented from the Affordable Care Act. So that is still a problem. The big issue for how they will get health care is how they get health care now, by going to county hospitals, by going to the emergency rooms many times when their diseases are much more advanced than they should have been had they had access to health care in the beginning. Community health clinics. I actually help support a clinic called the Westside Family Health Clinic. They've seen a skyrocket in the number of people, particularly undocumented, who come through their door to seek health. And that's what's going to happen. They are going to be the safety gap that keeps these people as healthy as they can be. But what people don't realize on both sides of the aisle is, as long as we have this huge undocumented population that is uninsured, that those will continue to have a drain on our overall healthcare system. The idea of the Affordable Care Act was that the more people that were insured, the less uninsured would go to the emergency room, and in the long run, all of our insurance costs would be lower because, as we know, it's the uninsured that go to the hospitals, and the hospitals pass that on to insurance companies and to all of us, and they turn around and pass it on to us. So until we bring in our undocumented brothers and sisters, this is unfortunately going to continue to happen.
What about Native Americans? Will members of federally recognized Indian tribes be eligible to shop on the online exchange? Are there special programs or eligibility requirements for them?
So with Native Americans, they already have a compact with the federal government through the Indian Health Service. But what's been shown is that the Indian Health Service for the longest time has been underfunded, and the access to care for the Native American population has been really, unfortunately, bad. So as part of the Affordable Care Act, there was more money that was given to the Indian Health Service, but the second part is Native Americans now have the right to participate in the exchange to further increase their coverage.
So they can just go and shop like others can.
Absolutely.
As individuals if they don't have health insurance through their employers or insurance that they're happy with.
And they're encouraged to do so just because it gives them even more access to health care.
Now, one of the main problems with the online insurance exchange, in addition to the glitches that are going to be a natural part of any website rollout today, is the issue of people being technically challenged, technologically challenged, elderly people, people with disabilities, people who may not have a computer at home. You mentioned earlier that there were, for that reason, call centers. So people who are listening right now through traditional radio and are worried about me referring to the online health insurance exchange, can simply just call that number as long as they have a telephone.
They can call the numbers. They can cover California, but they also, a lot of community groups in the area have gotten funding, different ethnic groups, different professional groups, to go out and speak to their membership and help them enroll. And there are navigators that are being trained that can also help people go through the process. So it doesn't have to be. My mom is 82 and she is very computer unsavvy. Fortunately, she has Medicare, but people like her who don't feel comfortable, they can actually call and meet with somebody face to face that can take their information and help them pick out the coverage that they need. And that's in multiple languages as well.
Now, what about, for example, unemployed spouses of employed people? Can they shop around and see if they can find a better plan through Covered California?
So this is what you're going to actually see more of. You're going to start to see more and more companies that provide coverage to say you and your spouse say we're only going to provide it to you. And basically your spouse and your children are going to have to get it on the exchange. Now, some companies will continue to provide benefits all around, but some companies will say it's cheaper for them just to offer to you because technically they're only supposed obligated to you. And I think that, but if you are getting coverage through your spouse's employer, chances are I think you're going to get as good, if not better, coverage than what you can get on the exchange.
So that person might, for at least now, want to stay in their spouse's coverage, or they can even shop around and see what
they can
there
see,
is.
and that's what the fun part about it is. People can actually just go online and put in their own demographics and information and see what's available to them.
Let's talk about small businesses. You mentioned companies that have fewer than 50 people certainly have a smaller pool of risk. What does the Affordable Care Act mandate for small businesses in terms of these online health insurance exchanges? Are some businesses actually even cutting benefits for people they do employ directly, not just spouses of employees?
So for companies that with less than 50 employees, they're technically not mandated with the Affordable Care Act to offer insurance. But if they want to, they are eligible for a very significant tax credit to help them implement that in their own companies. For employers that have businesses, employee numbers of 50 or greater, they initially, the way the Affordable Care Act was written was they were going to have to supply insurance to anyone that worked more than 30 hours. That has since been delayed by a year. They've given an additional year to figure that out. And the issue is this. There's been a lot of talk that this has led to decreased job creation, that this is the reason that there's more part-time employees, but that's actually not the case. Mark Zandi, who's a very well-known, well-respected economist, went back and looked at this, and he found that people, prior to even the Affordable Care Act becoming law or even becoming an idea, that companies, there was a trend already in the United States to push people to 30 hours. And people are conveniently using this as an excuse to continue on that. But now, the earliest we know is 2015 is when companies will need to comply with that. So the idea, if a company is cutting back and keeping people on 30 hours because something that's going to happen in 2015 just doesn't make sense.
Can small businesses and small business owners shop on the online exchange for insurance premiums for or insurance plans for their employees?
They can for again less than 50 employees, but because very much like a family of anywhere from 4 to 20 can, or if somebody has a lot of kids, they can go in and do that.
Right. My guest is Dr. Paul Song, and we want to now hear from you. If you have specific questions that we haven't covered yet about the online health insurance exchange, give us a call at 818-985-5735. That's 818-985-KPFK. And by the way, one caller called in making a correction that the penalty for not enrolling in the online health insurance exchanges is apparently a one-time $95 fee, not a monthly charge. And thank you for that correction. So, and this is just for the first year. Apparently, I understand that amount will actually increase to even hundreds of dollars each year. So that's a one-time $95 penalty for not enrolling. And of course, some young people might see that as worth paying and still not getting health insurance. Again, that phone number is 818-985-KPFK. We'll be back in just a minute with your calls about the Affordable Care Act's online health insurance exchanges. Stay tuned.
Part homage, part investigation, Men at Lunch is the sublime tale of an iconic American photograph, an unprecedented race to the sky, and the immigrant workers who built New York. Lunch atop a skyscraper, taken during the construction of 30 Rockefeller Plaza, depicts 11 workmen on their lunch break, perched along a steel girder 850 feet above the sidewalk. For 80 years, their identity and the photographer who immortalized them have remained a mystery, their stories lost in time. Men at Lunch opens on Friday, October 4th at Limley's Music Hall 3 in Beverly Hills. KPFK Film Club members are invited to call the front desk during business hours at 818-985-2711, dial 0 for operator for a pair of tickets. And if you aren't already a Film Club member, please consider joining at kpfk.org.
Welcome back to Uprising. I'm your host, Sonali Kolhatkar. My guest is Dr. Paul Song. He's a radiation oncologist, a visiting fellow with the California Department of Insurance on healthcare policy, and on the board of Physicians for National Health Program. He's also the executive chairman of the Courage Campaign, and he's here to answer your calls now about the Affordable Care Act's online health insurance exchanges that have launched today here in California. It's called Covered California, online at coveredca.com. Let's turn first to Callie calling in from Pasadena at 818-985-KPFK. Good morning, Callie. What's your question or comment?
Good morning, and thanks for the program. So I have two very quick questions. One is, if a veteran, a military veteran, is already receiving care from the Veterans Administration or is eligible for that care, how does that affect and or change their use of ACA? And then the second quick question would be, is there any coverage for long-term care insurance, which I understand to be something that someone who's still working would take out and start paying for, so that much later in life, if they become disabled, they can actually have at-home care? And thank you. I'll take the call, answer rather, off the air. Thank you.
Thank you so much, Callie. So the question is, are veterans covered who would currently be getting care through the Veterans Administration? And also, can people pay into a long-term care insurance that they can take advantage of once they are done working? Any idea, Dr. Song?
So with regard to veterans, the majority of veterans will still stay on the VA plan. That will still be their primary insurance. However, if they, I've had some veteran patients who have been interested in shifting away from the VA and transferring their care to the private side. And some of them have gotten private insurance through new employers, but if you are technically unemployed, you would still stay on through your veteran VA program.
And what about a long-term care insurance?
So this is the problem with the Affordable Care Act. Initially, it was written into the Affordable Care Act as a crowning plus of that, because long-term care is a big problem that's starting to bankrupt more and more families, particularly if you have somebody in your family that has gotten a chronic illness. Unfortunately, that is not part of the Affordable Care Act.
Okay, let's turn next to Tony calling in from Long Beach. Tony, good morning. You're on the air.
Good morning, Tony Taylor from Long Beach. Real quick, I know the empirical evidence shows in this current world economic system that the European Scandinavian healthcare system is the best. Obamacare, so what we're talking about now, is a compromise. Here's my question. The right wing and the upper class, and the Republican benefactors, puppets, they promote the alternative. What is the alternative? What is there to gain from opposing the Affordable Care Act?
That's a good question, and a political one, which Dr. Song certainly, I'm sure, has an opinion on. What is their alternative suggestion?
Well, that's the question. I've not heard them say anything that of substance rather than let the free markets rule, but we know there is no free market in healthcare. Do you realize that there are only two industries in the whole United States that are exempt from antitrust legislation, Major League Baseball and the health insurance industry? And yet they want the free market to happen, and they think miraculously that when you're having a heart attack, you can sit down and negotiate with your doctor what price you're going to pay for your angioplasty. Simply not possible. The other thing has been there's been such big consolidation of private insurance industry companies that in most markets the health insurance industry is dominated by one or two insurance companies. So the idea that you or any of us can negotiate insurance rates in a meaningful way just is simply not possible. So there's no free market. So for those on the right that say that let the free market rule, there's no data to say that works. The exchanges are designed to try try to level the playing field. We now have 56 different health plans in the state of California that are participating in the exchange, and as a result, we're starting to see costs come down. But as you do mention, for those of us on the left who really are looking at empirical evidence, we know the most successful plans are a single-payer plan, a Medicare for all, where we remove the private insurance industry from the decision-making as well as the profit-taking. Currently, the private insurance industry takes 30 cents of every dollar away from actual patient care to use for exorbitant salaries, marketing, overhead. If we could use that money and put it back into the system, we'd have more than enough money to increase everyone's benefits, but also ensure the undocumented and really lower costs for all. So you're absolutely correct. But at the same time, we do need to see the ACA succeed. I think if this fails, then most people will say the government is incapable of being involved in health care, even though all they're doing is using money to help us buy a for-profit product from the private insurance industry.
You know, it would be so interesting if in addition to your zip code and your age and salary, you could also tick off the box that identifies you as a Tea Party Republican to find out how many of them might want to shop around for the insurance plans. Let's take another call from Rick, who is in Santa Monica. Yes, go ahead. Rick, are you on the air?
Yes, I'm on the air. And I have a serious question here because according to the United States Department of Health Services, there's only 4.5% of the population, and this was in 1997, there's only 4.5% of the population that are considered healthy. We have 300 million sugar addicts in the country, according to them. We are bombed by...
Can you get to your question real quick?
I'm coming. You just give me a second. How are we who are working with preventative health care, and how are we who are not wanting to work with insurance companies who steal the money from the people and don't give them anything, really, and an allopathic medical system which is killing about 3 million people a year with iatrogenics? How is this going to help us?
So that's a really good question. So Dr. Song, for those people who really have, out of choice, opted out of the medical care system and the health insurance system because they don't like Western medicine, et cetera, what options do they have?
Well, two things. One, with regard to the iatrogenic, those are medical-induced deaths or complications. Part of the Affordable Care Act is designed to improve quality through these accountable care organizations and increase the metrics to try to reduce hospital-related infections and mistakes in general. With regard to the allopathic or natural course, the Affordable Care Act, again, it's still a work in progress. So for those that are in the alternative medicine field or in the naturopathic medicine field, as you start to provide data to show that what you're doing does ultimately improve health, I do think that they will start to increase the benefit and the coverage of that. I've seen that in my own practice as a cancer doc with things from acupuncture to massage therapy. Once there's been data to show that that really does improve the outcome, the insurance companies have been covering that. But that's really much more of a greater issue outside of the Affordable Care Act and more of getting these alternative therapies readily accepted by doing good clinical peer-reviewed data.
Let's turn next to Tom calling from Ventura. Tom, good morning. You are on the air.
Thank you. Good morning. My question is about my own situation. I will be retiring on June of 2014. Currently, I'm insured by my employer, and I have a wife and a child. So am I required to register before that March deadline, or do I need to wait until I'm actually retired? I know exactly what my retirement income will be, and so on.
And can I ask you, how old are you?
I am 64.
Okay, so you're right in that in-between age, so that means that you would need to find private coverage for, actually, no, I take that back. You could actually qualify for Medicare No, I'm Social Security. You could. I'm sorry. So you're in that in-between age. At the age of 65, you will then be eligible for Medicare, which I believe is the best insurance that you can get. So in the meantime, in those 6 months, you may need a supplemental plan. It sounds like through your employer, you may be able to get COBRA for the 6 months until you're eligible for Medicare, and that might be the best situation. So you can keep the coverage that you have for the 6 months until you transition into Medicare.
Right, and that's basically a continuing coverage, the kind of coverage that people can get when they change jobs. Usually the government allows you to keep your existing coverage for a few months in between those stages of your life. Let's turn next to David calling in, also from Ventura. Good morning, David.
Good morning. Hi. Let me just say that I'm all in favor of Obamacare. Here's my question. It has to do with like the plan particulars. Would I be qualified, or my family qualified, to pay, like, say, the copay for a critical care visit for, let's say, the silver plan? I think it's $65 online. If I have not paid the annual deductible, like, do I have to pay the annual deductible first before I can begin to get some of the other benefits, such as the copays?
So the copays are all part of your deductible. The deductible just means that whatever your deductible is that you choose, that out of your total cost, that's what you're responsible before the insurance starts to kick in. So when you say go to see your doctor in the very beginning, you are not only paying the doctor, but you're also paying the copay at that particular moment, and that all goes towards your deductible.
And once you meet your deductible, if you still need to see the doctor before the end of the year, then it is free.
Depending on the plan. Some plans you may continue to need to pay a copay.
Okay, so that all depends on the details of the plan. Let's turn next to Curtis calling in from Pasadena. Good morning, Curtis.
Good morning. My question is, I work in television, which means I'm working 9 months out of the year. 3 months out of the year, I'm not, so I'm not covered. Am I required to buy a plan that covers just those 3 months? And what happens when that occurs after the window to enroll has closed?
So that's a great question. So with regard to after the window closes, you cannot go buy coverage, or will you be covered? And if something happened to you during that period of time, you would be responsible for whatever your health care costs were. With regard to working 9 months and having 3 months of no coverage, again, what I would encourage you to do is to see if you could use just the COBRA part of that rather than trying to get on the exchange. It's a really good question, and I'd have to check with somebody at HHS to see how you would be eligible, because that's honestly something I've never been asked before.
But it might be a common question given that we're in Los Angeles. So let me give out the phone number for the call center for the California's online health insurance exchange, where you can actually talk to a representative about complex questions like this that are beyond the scope of this program. 1-888-975-1142. Write that number down if you have questions that either we don't get to or questions like the one we just got. 1-888-975-1142, and hopefully they will give you an answer to that. Let's turn next to Jeremy calling in from Lawrence, Kansas, non-California state. Good morning, Jeremy. Thanks so much for listening. Hi, Jeremy. You're on the air.
Former Los Angelino here. I wanted to ask about the political implications of this individual mandate. I'm pretty low income. I've just recently returned home to take care of our young son, and my partner, she's gone back to work. I think that I'd like to get coverage, but I don't like being forced into giving my money and labor to big corporations. And so I want to ask about how we're going to find our way out of the bad implications of the individual mandate, where short-term, yes, it's great that poor people who didn't have access to coverage are going to have that access, but over the mid to long term, it looks like middle-class folks and even those lower-class folks are going to be fed into a system, forced into a system where they'll be at the whim of big pharma and big health insurance. And so I want to ask, is it possible that the real progressive left could get together with the real libertarian right around this issue of the individual mandate, where the right says we need a compelling vision for individuals to be able to compete, and then on the left we have people who want to see a compelling vision of individuals to be able to cooperate to provide for everybody?
Thank you.
And,
Thank you so much, Jeremy. Dr. Song?
Wow, that's a really great, complicated question. In theory, I actually do agree with you. I hate the idea that the government is forcing us to buy insurance from a for-profit industry that really only makes money by denying us care. But having said that, I do think that in order for this current plan to work, everyone does need to participate. The individual mandate, I know everyone's made a big deal out of it, but when you look at it, it's really out of the 51 million that are currently uninsured, it's roughly 16 million that will fall under the individual mandate, which is roughly 5% of our entire country. And yet everyone seems to think that this is affecting the entire nation.
And why isn't everyone included in that individual?
Because those of us that have coverage either through Medicare, the 50 million seniors that have Medicare, or have employer-based health insurance, technically are not subject to the individual mandate. So it's that 5%. Like yourself, and I absolutely agree. I actually would like to see things go one step further and remove the health insurance industry from our entire process. But that's a much longer, long-term goal.
Well, we have lots of questions and very little time. Let's turn to Cliff, who's been waiting for a long time. Cliff, calling from Los Angeles. Good morning.
I'm the business manager of Roofers Union, Local 36 in Los Angeles, and most of our members are covered under our multi-employer, or what they call Taft-Hartley plans that are negotiated in our contract. The building trades have been very supportive of the Affordable Care Act, but now we've come to find a lot of concerns that our non-union competitor contractors are going to find it more cost advantage to kick their employees into the exchanges and just pay the penalties, and that our union contractors that we've partnered with in our contracts are going to have a much greater expense. And I'm asking how can I explain this to our union members in the building and construction trades who have supported President Obama in getting this health care package, but now find that we're going to be at a great disadvantage cost-wise.
Thank you very much for that call, Cliff.
You've reached really touched on a very problematic part of the Affordable Care Act that I've actually talked to several unions about this, and they share your similar concern. And unfortunately, the way things are, particularly with Cadillac plans and the taxes that will be on Cadillac plans, this will directly affect the labor health care. What I would say is that that is something that you all need to continue to work for and fight for, and we will with you to get that improved upon. I think most people realize the Affordable Care Act is a starting point. It is not the definitive end-all. When Medicare was first initiated, it was not nearly what it is right now, and that's something that we need to all one of the areas that needs to be improved upon. But I think that is a limitation.
Unfortunately, we're out of time. We have so many more questions. And what I'd like to do is ask our listeners to go to uprisingradio.org if you have access to the web. And please post your questions on our website after 10 a.m. this morning. We are going to try to get those answered for you. Again, that's uprisingradio.org. Dr. Paul Song, thank you so much for spending this hour with us.
Thank you so much.
Dr. Paul Song is a radiation oncologist, member of the faculty at the Samuel Oschin Cancer Center at Cedars Sinai Medical Center, visiting fellow with the California Department of Insurance on Healthcare Policy, on the board of Physicians for National Health Program and People for the American Way, and executive chairman of the Courage Campaign. For Sonali's subversive thought for the day, Dennis Kucinich once said, "Everyone should have health insurance. I say everyone should have health care. I'm not selling insurance."